Hi, everybody, and thank you so much for tuning in today to another episode of the Revitalize Woman Podcast. Today, I'm talking all about preparing your body for childbirth, and I'm actually recording this right now at home on maternity leave. So, hopefully, you don't hear any babies crying. I got the kids out of the house today, so fingers crossed this works. But after working with numerous pregnant ladies and going through this myself, I know it can be scary, exciting, nerve-wracking, and challenging all at the same time. And I also know that there's a lot of information floating around about what you should and shouldn't do while you're pregnant. So today, I'm going to focus on the main topics that will help you best prepare for childbirth and to help set yourself up for a better recovery after baby. Having three babies in under 3 years has been challenging in so many ways, but physically, I have asked my body to do so much for me. I feel so grateful that I was able to rely heavily on my professional knowledge and tips that I've learned from other professionals along the way in order to help myself. Before I dive in, though, I just want to say that the advice and the tips that I'm going to give you today are focused primarily on the physical attributes of preparing for childbirth. That's kind of my wheelhouse as a pelvic floor physical therapist, so that's what I want to focus on. However, I want to say that emotional and mental health are just as important and should not be forgotten. It's just not what I'm going to cover today. So if you want to learn more, you can check out episode 16 with Sarah from the Mom's Mental Health Initiative. I will link to that in the show notes so you can get that info if you're interested. All right, so diving in, a couple of things that I wanted to talk about when you're preparing your body for childbirth. A lot of people think of, what exercises are you going to do to help prepare? So exercise is definitely important. I will talk about that, and I'll also talk about how you can help prepare your pelvic floor for childbirth. But then I also want to kind of get into a couple things with nutrition, other professionals that can maybe help you prepare, and then a couple tips that you can do now that are going to just help yourself in the postpartum period. Because once you have that baby, everything becomes kind of a blur, and it's just important that you have some of this lined up or in place beforehand. So diving into exercise, I think that's kind of one of the biggest topics or areas. Like I said, exercise is important, and there is just a lot of information on the internet, in magazines, from friends, providers, etc., that really stress exercise as one of the biggest components for preparing. And a lot of people will say that childbirth or labor and delivery is equivalent to running a marathon. And I'm not going to necessarily disagree with that, but it is different. Yes, you're not running a marathon, but people say that because it's a long process and there's an endurance component to that. And being in kind of a more active or physically fit state can definitely help you kind of go through those physical demands on your body during labor. So that's kind of what people mean when they say that. Now, there's also a lot of things that say pregnant women should only walk, swim, and do yoga. I see that a lot, and that's also not true. So when it comes to exercise, the most important thing is doing what feels right for your body, and also doing something that is kind of in your physical limit. So an example is if you were doing maybe just daily walks and yoga once a week before you got pregnant, you don't want to all of a sudden jump into CrossFit or heavy weightlifting now when you're 6 months pregnant. So you don't really want to start something that's brand new, that is going to be highly demanding on your body, because it's just going to be a little too much. If you were doing weightlifting and CrossFit and those types of activities before pregnancy, then it's definitely okay to still continue that on throughout pregnancy, as long as your body is feeling okay. So your body is going to tell you what is too much, and you really need to listen to that. If you're having pain or discomfort, or it's really, really hard to recover from your workouts, that is all going to signal that maybe you need to back off and scale down a little bit. It's really normal that as pregnancy progresses, that you might have to cut back a little bit. You're not going to necessarily be able to do everything that you did early on in pregnancy or before pregnancy at the end, and that's okay. The biggest thing is you just want to be active. So don't get too hard on yourself if you feel like you need to scale back. Just kind of like a personal story for you. When I was pregnant with my first, I worked out a lot prior to that. I like to lift weights. That's kind of my exercise of choice. So I was in pretty good shape. I was lifting heavy weight. And I really, really pushed myself to kind of continue that on throughout my pregnancy. I'm glad I did. It kept me active. It kept me, physically fit. However, looking back in retrospect, I definitely pushed myself more than I should have. There were definitely times that, especially at the end, where I really should have started scaling back and cutting down. And there were days when maybe I was having pain. My body wasn't really in a good place to be doing a heavy workout, but I really pushed myself to do it anyways. So I kind of learned from that. And in my second pregnancy, still tried to make weights a priority and doing exercise, but I really listened to my body a lot more. If I was really, really tired that day, maybe I skipped my workout and I rested instead. And that was okay. Or maybe I went for a walk instead of doing weights. So that I think really helped kind of get me through that second pregnancy and not be as hard on myself and not push myself more than I should have. And then my third pregnancy, really, let's just be honest, I didn't get a lot of exercise in. Walking, I walked pretty often, maybe not every single day, but pretty close. And being home with the two other kids was just kind of crazy in itself. So that was a lot of my activity. And then I kind of switched over and did more prenatal yoga and focusing a lot more on stretching versus strengthening. So I still did some strengthening, but a lot of mine was geared on stabilization. I had a lot more pain and instability on this third pregnancy. So the exercises I was doing was really focused on that. And that's okay. And I was okay with that. So kind of moral of the story is it's going to look differently. Every pregnancy is different. Every person is different. And so you need to kind of work within your limits, recognize those limits, be okay with that. And, just try to find something that keeps you active. So if that's walking, if that's yoga, if that's lifting weights, whatever it is, just try to find something that does keep you somewhat active, because the more, the more muscle mass you can have, the stronger you can be, is not only going to help you kind of get through that labor and delivery phase when it is very physically demanding, but also it does help you in that postpartum phase, because now you have a baby to take care of. And if you're so weak, it's going to be really difficult. So that's kind of what I want to say in terms of exercise. There is no one size fits all. Still try to do something, whatever that is. And, be okay with needing to rest also. So finding that balance can be really helpful. It is also really helpful to try to incorporate some stabilization exercises, regardless of what you're doing in terms of activity level. This is really focusing more on core and hip stabilization, because this is going to help you get through those kind of last couple of weeks or months of your pregnancy where maybe you are starting to have some pain or difficulty. So really focusing on that can be highly beneficial. We talk pretty often about your transverse abdominis. So those that have tuned in before or watched any of our video content have probably heard us talk about that. So if you want, check out our YouTube channel for some exercise options for stabilization with that. And again, we can link to that in the show notes for you. The other thing I want to say in terms of exercise, if you are doing some kind of weights, it doesn't even have to be like heavy weightlifting, but if you, really anyone should be able to do this, but a couple of exercises that are really good to start incorporating now to prepare are things like squats and deadlifts, because that's going to simulate kind of childcare tasks, a lot of bending and lifting and bending over. And we don't always have the best body mechanics once we have a newborn. So those exercises can be really helpful to help kind of set you up for postpartum. But squats can be really good for you to help kind of open up that pelvis and encourage better positioning for baby. So something that we teach often at the office are kind of like a deep squat where you're holding it and just helping stretch. So that's one option. Or just doing regular squats at home can also help. It just helps kind of keep the pelvis open, if you will. And so baby has a little more room to drop down into the pelvis, which is ideal what you want. There are a couple other things too, like cat-cow and happy baby pose that can also help just help encourage that positioning for babies. So there is a website, Spinning Babies, that gives a ton of different options and suggestions for stretches and exercises to facilitate baby's position. So that's something you could check out. But I would say cat-cow is something that pretty much anyone could do. It's going to be beneficial regardless of how baby's positioned. So that's a really good one to do, especially in your third trimester as you start preparing. The reason it's important is you want to facilitate a good position for the baby, so baby can kind of drop down into that pelvis and start engaging with your cervix. So what that means is baby's head is kind of in contact with the cervix, and you ideally want the head kind of squarely in, sort of like you're trying to fit an egg into the top of a cup or something. That's going to help the cervix start to thin out and dilate, which will help induce labor naturally, only when you're ready, so don't worry. But it can also help with having the baby in kind of the right alignment or position will help your labor go a little bit quicker. So again, just a quick story with this last delivery with Mac. I was in labor for like 2 weeks. I had 5 days straight of prodromal labor. So every single night, contractions would start, they would ramp up, get stronger and stronger, and by 4 a.m., stop. And it happened like clockwork every night. And so I did some positioning to really try to help get baby in a little bit of a better position, and that helped stop those contractions early on, because ultimately baby's not going to come until baby's ready. But if it's not in a great position, and we were thinking along with my midwife that maybe the head was slightly tipped to the side and not making the best contact. So doing these things kind of throughout third trimester can help. So add that into your exercise, and it'll really help kind of get baby ready, get your pelvis ready. And doing squats also is going to help you, because maybe that's a good position for you during delivery. A lot of people will push in kind of a squat position. So, and that's a really good position to help minimize trauma. So moving on to what you can do in terms of the pelvic floor, this is another really big question that we get often. How do you prepare your pelvic floor for delivery? Now, if you already have a planned C-section, please don't skip ahead, because this is still important. Your pelvic floor can still be affected even if you are having a cesarean. So don't think that you are exempt from this topic. Obviously, if you're planning a vaginal delivery, that's going to be a little bit more important, but still an important aspect for a C-section too. So, excuse me. So a lot of times people think that they need to strengthen their pelvic floor. I see this a lot. A lot of people are told that you need a strong pelvic floor in order to push the baby out. And that's not true, actually. So your pelvic floor is actually not the muscle that's pushing the baby out. The pelvic floor essentially needs to kind of relax and allow everything to kind of open up for baby to pass through there. Your uterus is what is doing the work to really push baby down. That, and then you're going to kind of use your abdominals too. So, sorry. So this is kind of a really big misconception. It's something that we're working in the office to help change. So we're doing a research study right now on this topic, because our technique is really working in that third trimester to relax the pelvic floor muscles, help them lengthen, release anything that's tight in order to have a better labor and delivery. This has never been studied before. A lot of pelvic floor PTs recommend this just based on how the mechanics work, but it's never been studied before. So we're really hoping that this will give us kind of that concrete data to help back it up. But it's not finished yet. So hopefully by next year we have that, and then we can more definitively say if that protocol is making a difference or not. But in the time being, anecdotally, we've seen this for years now with the patients that we've worked with, that by helping to release those muscles leading up to delivery, people tend to have faster deliveries. So they spend less time pushing, they have less tearing, less C-sections, and a better recovery. So we kind of recommend don't do strengthening exercises for the pelvic floor in that third trimester. If you want to do them early on in pregnancy, that's fine. But by the third trimester, we really want to work on relaxing and lengthening and no longer trying to strengthen. The reason is, if everything is contracted, it's going to make it harder for baby to pass through there. So some of the stretches, like belly breathing, and then some of the things we talked about, like happy baby pose and that deep squat, can really help with that. but we rely heavily on doing some manual techniques to actually release and lengthen those muscles. So if you're interested in learning more about that, I'll link to the research study in the show notes, but you can also find it on our website too. If you are having a planned C-section, it's still important that you aren't trying to kind of over strengthen your pelvic floor muscles, because that can still lead to issues after baby, like incontinence, painful sex, even urgency and frequency. So it's still a good idea to still focus on kind of that relaxation component at the end and not overdoing it with strengthening. It's also important that you learn how to properly push for delivery. So we always kind of teach patients, you want to breathe the baby down. So you're essentially, a lot of people say like you're pushing like you're trying to have a bowel movement. So that kind of pressure, and it is true, the pressure you're going to feel is going to be more rectal pressure almost when you're pushing the baby out. And you want to kind of focus on that. That's kind of where you want to feel that pressure directed. So the biggest thing is people tend to hold their breath and then push. That's considered a Valsalva maneuver, where you're holding your breath and then doing something with exertion. And that's not a great idea. You actually want to kind of push as you're exhaling. The exhale is going to help the abs contract to help push baby down. And with breathing, you're not putting added strain on your pelvic organs. So a lot of times when you're holding your breath and then trying to push, it's counterintuitive, because everything is going to be tensed and tightened up. It's going to be harder to get baby down, but it also puts this added stress and can increase your risk for prolapse. So really try to make sure that you're exhaling as you push, working with that contraction, and then really trying to stay as relaxed as possible. The more you're tensed or tightened up, the more all your muscles are going to do the same. So trying to like relax and thinking of like that exhale to kind of push out and relax can help lessen your pushing time and also lessen your tearing or your trauma to those muscles. So really important that you can even practice that beforehand. Just don't overdo it, because again, we don't want to put added strain on the pelvic organs. So moving on, I wanted to just touch base a little on some nutrition things to help kind of prepare your body. So a lot of times we just think of the delivery aspect for childbirth, but we also kind of need to be functioning throughout pregnancy in that postpartum phase. So one of the things that's important is making sure you're getting enough protein during pregnancy. I know it's hard because sometimes you don't feel good, you have food aversions, you just crave carbs, but really trying to incorporate some protein in is going to help you stay full, so you're not eating as many carbs. And it's also going to help your body retain as much muscle mass as possible. That's important. You want to be as strong as you can after you have that baby so that you can take care of the baby. It's hard if you have a 10-pound baby and you're holding that baby and carrying it around and picking it up, bending, down to the floor and standing. It's a lot. It's physically demanding. So make sure you have a lot of protein in your diet. But the other thing that I really like to recommend is taking an omega-3. So most people take prenatal that has an omega-3 in it. But one of the big things is there's a component called DHA, and that is within omega-3. That is really important for your baby's brain and nervous system development. And typically, most prenatals are only going to have the bare minimum of that DHA for baby's development. And what happens is baby ultimately starts to suck that DHA from us. We use it heavily for our cognitive function. And so what happens is you start to get that mom brain, a lot of that fogginess, memory issues. It's difficult to find the right words to say. All of that are symptoms of having not enough DHA. So adding in an extra omega-3, even doing it during pregnancy, can help minimize that, and then especially after. So sometimes it's hard. I've always had a hard time taking omega-3 during pregnancy because they're such large pills. And so sometimes it's really difficult for me to take that. And so if that's the case, I typically wait until postpartum. But if you can, it's helpful. Magnesium is also really helpful during, because it helps for a couple things. It's going to help you sleep better. It's going to help keep bowel movements a little more regular, because constipation is very common during pregnancy. And it also helps your muscles and your smooth muscle like relax. So especially as you're coming into that third trimester, you want that pelvic floor to start relaxing. And ultimately you want all your smooth muscle, like the uterus, to kind of relax so you can prepare your body for delivery. So magnesium is also great. And then the last thing is a good probiotic. Good gut health is super important because, for a couple of reasons, but one of the big things is that everyone kind of gets tested for group B strep. Having a good probiotic and good gut health can minimize that, so that you don't have to take antibiotics, which can really kind of wipe out your gut health, if you will. But it's also going to help with better digestion. So I talked briefly about constipation being an issue. We want to avoid constipation, because if you are constipated, it's going to put a lot of strain and pressure on the pelvic floor, pelvic organs, and even the abdominals. So it puts you at risk for diastasis and prolapse and incontinence issues. So having a good quality probiotic can really help kind of keep things moving and minimize that stress on all of those structures, which ultimately will help you better for childbirth and recovery. So the less damage to your body during pregnancy, the better the childbirth, the better the recovery. Ideally, in a perfect world, it doesn't always happen. So, but yeah, just a couple of things with that. And we do have a couple good high quality supplements for those things. If you're interested, feel free to reach out. We can talk more. And then I wanted to just like 2 quick tidbits of advice to prepare yourself for postpartum. I am a huge believer in doing sitz baths, whether it's you buy the little tub thing that hooks onto the toilet, or you just soak in the tub. I always just soaked in the tub because, I don't know, it was just my preference. So if you could soak for like 10, 15 minutes a day, that's awesome. I think it's really important to do in that postpartum phase to help with healing. It's going to help your tissue heal better. It's going to help eliminate any kind of swelling. And it's also going to just help kind of clean everything. So, there's just a lot going on after you have a baby. And so you want to make sure that you're kind of keeping the tissue clean without necessarily using soap. So you don't want to wash all of your lady parts with soap and water, because the soap is going to kill off the good bacteria, and that's going to lead you a lot more prone to an infection. So just being able to soak in a sitz bath is enough to kind of clean things without wrecking the bacteria that you want. So, and that's just in general, you shouldn't be washing with soap. Just water is enough, like, for everybody, not just during pregnancy or postpartum, all the time. So I would suggest ordering some kind of like sitz bath soak, or an Epsom salt mix. So there's a lot of different options out there. They have like a salt that you can add to it, or they also make ones that come in like tea bags that you would steep in the tub. I've used both different options, and I've used several different brands and have been pretty happy. So that's something you can check out and get, so that you can start doing that postpartum. And then I also recommend icing for the first 48 hours after delivery. Or if you're still having pain or you notice swelling, to ice a little longer than that. And that goes for both. If you have a C-section, ice on that incision if you can. I know oftentimes it depends what they put on it, but oftentimes you don't want to get it wet, depending what kind of bandaging you have, things like that. But if you can, I would ice. If you have a vaginal delivery, if you are typically, if you're at the hospital or the birth center, they will have ice diapers or ice pads for you to use. So I would use them as much as you can for those 48 hours. But it's not a bad idea to make your own padsicles for when you get home, so you have some available to you to ice, especially if you're having any kind of pain or discomfort. So when you're icing, you also want to do like 10 to 15 minutes tops, and then kind of take it out. You don't want to ice for too long, because then everything gets really cold and brittle, kind of. So 10 to 15 minutes, and then, like I said, if you can do it frequently throughout the day, typically how I've always done it myself is, especially that first day or two, like whenever I'm going to change the pad, I'll put like a new ice pack in or something. So probably every couple of hours you're putting a new one in. But that's super important. So at least for 48 hours. And then, like I said, if you're having pain or discomfort, if you had tearing, it's common that women are still pretty sore out of that 48-hour window. So maybe you're not icing as often, but it's still nice to do at least maybe 2 or 3 times a day. So that is kind of a lot of the physical things you can do to kind of prepare for childbirth and also set yourself up for better recovery. But I also want to just kind of put in a side note here that also a couple of things to consider is maybe reaching out to other professionals. So looking at maybe a doula, which can help. They're basically a support person that is going to help you during delivery to kind of A, get you the things that you need, B, help with pain management, and C, kind of help guide you on what you want for your birth plan. So a doula can be really helpful. And then getting a health team involved while you're pregnant can also have a big impact on your delivery. So things like a pelvic floor PT, a chiropractor, an acupuncturist, those are all really great healthcare professionals that can impact how your body is and how your delivery goes. So a lot of women think that, oh, I'll just wait till after the baby and then, help for recovery. But oftentimes I tell people it's my preference is to start working during pregnancy because I think it can make a big impact on how your delivery goes and ultimately your recovery. So those are all great options. And we have a couple other podcast interviews with some of those professionals. So I'll link to those in the show notes for you if you want to learn a little bit more about what they do and how it can help. But I would suggest maybe looking into that if you're interested. And then the last thing is make a birth plan. So we've talked a lot about, physically what can you do to get ready, but a birth plan is important to kind of help you have the delivery that you want to have. Now, obviously, things change. It doesn't always go as planned, and birth is an unknown. You never know how it's going to go. It can be different for every baby. It's different for every person. So there's a lot of unknowns, and there's a lot of things kind of out of your control, and that's okay. But at least taking a little bit of time to sit down and think about what's important to you. A lot of women don't realize that they have options when it comes to how their delivery goes, labor and delivery goes. So sometimes it's nice to kind of educate yourself on, what are your options without just necessarily saying yes blindly to everything. Learn, do certain things have certain consequences, etc. So, just as an example, if that doesn't make sense to you, an example is, do you want an epidural or not? Or are you gearing more towards a natural childbirth? Those, I guess that factor is super important to know ahead of time, especially if you want a natural delivery, because it takes a little bit of a different preparation if you want to do a natural delivery. You need to kind of be in that headspace of doing that and having different pain management techniques at your fingertips because you're going to need them. And so, thinking through that, and, there is no right or wrong answer, and everyone is different, but knowing sometimes an epidural has kind of this sequence of events. Sometimes an epidural can prolong labor that can oftentimes lead then to some issues with the baby's heart rate. And so there's kind of a cascade of events. Now, that doesn't always happen. Like I said, everyone is different. There is no right or wrong, but just thinking through some of those things so that you at least feel confident in your choices. And if things go differently, so be it, that happens. But at least you kind of had an idea. You've thought through those things, and that can be really beneficial. Even thinking through like different pushing positions can be helpful because depending how you're pushing, like what position you're in, can impact your trauma to your body, and even how long you're pushing. So kind of getting some of that information can be helpful to prepare. So not totally physically related, but super helpful. And I'd highly recommend that. But I want to say thank you so much for tuning in today. I hope this is helpful for those of you that are pregnant or hope to be pregnant, soon to be pregnant, kind of getting ready and thinking through some things to do, during your pregnancy to help you prepare. I don't think this information is talked about enough. We definitely don't talk about postpartum recovery enough, but I think even just, thinking through what you can do differently to prepare your body is also super helpful. So I want to say thank you again. If you want any of the resources that I talked about in the episode, head over to our show notes. That's at revitalize-pt.com/EP22. So again, revitalize-pt.com/EP22. And then to just leave you with a parting gift, your pelvic floor tip of the day is make sure you take the time to focus on belly breathing before delivery in order to help that pelvic floor release. So check that out. We have videos on our YouTube to kind of teach you how to do belly breathing properly. It's a mouthful, but I hope that helps, and I wish you luck with your delivery. And I am going to get back to my motherly duties here with the baby, and so I will see you all soon. Looking forward to getting back into the office in the next couple of weeks, and we've got some new and exciting things in store for you too once I'm back. So have a great day, everybody, and we'll see you again soon.